He was drawing a dragon. That is the detail his mother remembers most clearly. Not the handcuffs, not the patrol car outside the middle school. The dragon, half-finished wings stretching across the margin of a science notebook because his hands needed to keep moving for his brain to stay focused. He was 12 years old, diagnosed with ADHD since age 8. He had an IEP, an individualized education program, a legal document the school signed. It specifically said movement helped him regulate attention. It specifically said fidgeting was not defiance. But the new teacher had not read it. She told him twice to stop drawing. He tried. The pencil came back into his hand almost automatically, leg bouncing under the desk, brain trying to regulate itself. He got sent to the office. The school resource officer was already there, and a situation that should have ended with a redirect or a phone call home turned into handcuffs. I ran programs inside Florida DJJ facilities, Department of Juvenile Justice facilities, and after enough years inside those buildings, patterns stop looking accidental. You start recognizing the same child over and over. The boy suspended 10 times before 7th grade. The girl called aggressive because she shut down when adults cornered her. The teenager written up constantly for non-compliance when half the staff never implemented his accommodations in the first place. Families get told these are isolated incidents. They are not. There is a pipeline in this country that turns untreated disability, trauma, and mental health needs into discipline records, police contact, court involvement, and detention. And the pipeline often starts in school, especially for Black and Latino children. The system did not begin by seeing disability. It began by seeing defiance. That distinction changes everything, because once a symptom becomes misconduct, punishment becomes easier to justify. Fidgeting becomes disruption. Walking out of class becomes insubordination. Emotional overload becomes aggression. Trauma responses become threats. And when schools respond to support needs with exclusion instead of intervention, the child starts moving step by step toward the juvenile justice system. Parents usually notice the incidents first, the suspensions, the calls from school, the write-ups piling up. But what many families do not see yet is the pattern underneath. A child struggles with attention, emotional regulation, trauma, anxiety, learning disabilities, or depression. Supports are delayed, inconsistent, or ignored. Behavior escalates because needs are unmet. Discipline records build. School police get involved. Court follows school discipline. Detention follows court. That is the pipeline. And once you understand it, you start recognizing how predictable it really is. Here is the number that should make every school district uncomfortable. Around 70% of youth in juvenile detention have diagnosable mental health conditions: ADHD, depression, anxiety, trauma-related disorders, learning disabilities. 70%. When people hear that number, some assume it means kids in detention are simply troubled. That is not what the statistic means. What it means is systems are funneling untreated needs into confinement. Inside Florida DJJ facilities, I saw intake paperwork filled with histories of school suspensions, failed interventions, psychiatric diagnoses, interrupted medications, learning disabilities, trauma exposure. You would read a file and realize the warning signs started years earlier, sometimes in elementary school. A kid gets labeled early: behavior problem, disruptive, defiant. And once that label sticks, every future incident gets interpreted through that. One referral becomes 5. 5 becomes 15. Teachers start expecting conflict before the child even walks into class. And Black and Latino boys especially lose the benefit of being seen as children. The same ADHD behavior interpreted as immaturity in one student gets interpreted as danger in another. Same behavior, different consequences. That phrase matters because families already know it is true. 2 students talk back, one gets redirected, the other gets suspended and searched. 2 students leave class angry, one gets sent to counseling, the other gets charged with disorderly conduct. Research has documented this for years, but parents do not need a study to recognize what they have lived. Schools serving Black and Latino communities are also more likely to be under-resourced. Fewer counselors, longer evaluation delays, higher staff turnover. overcrowded classrooms, burned out teachers trying to manage 30 kids at once. And when systems are overwhelmed, discipline becomes the shortcut, especially for children whose needs require patience and consistency. Take ADHD. ADHD is constantly misunderstood in schools because people reduce it to can't sit still. But ADHD affects executive functioning, impulse control, emotional regulation, attention shifting, working memory. A child with ADHD may know the rule and still struggle to follow it in real time. That matters because schools often treat inability as refusal. The child blurts out answers, gets labeled disrespectful. The child forgets assignments, gets labeled lazy. The child reacts emotionally too fast, gets labeled aggressive. And then schools punish the symptoms while claiming they are addressing behavior. The paperwork says the child has protections. Real life says otherwise. That gap is where families get trapped. A lot of parents assume an IEP automatically protects their child. It does not. The document matters, but implementation matters more. An accommodation only works if adults actually follow it. And schools fail here constantly. Substitute teachers never receive the plan. General education teachers skim it once and forget it. Behavior plans are inconsistently followed. Breaks are denied. Sensory supports disappear when staffing gets tight. Then the child gets disciplined for behavior directly connected to supports they never received. I saw families bring thick folders to meetings proving accommodations were ignored for months. Emails unanswered, incidents documented, patterns obvious, and schools still framed the child as the problem. This is why discipline records become so dangerous. They create a paper trail that slowly transforms support needs into evidence against the child. By the time police get involved, schools often say things like, "We tried everything." But families know everything often did not include consistently implementing the IEP, or conducting proper evaluations, or understanding trauma, or training staff adequately. A lot of children enter this pipeline before they are even formally diagnosed, especially trauma-exposed kids. Think about a 14-year-old girl who flinches when adults raise their voice, who scans rooms constantly, who escalates quickly when cornered. Schools may describe her as oppositional, defiant, disrespectful. But trauma changes the nervous system. Children living in chronic stress learn survival responses: fight, flight, freeze, hypervigilance, shut down, explosive reactions. The body reacts before the thinking brain catches up. And schools punish these responses all the time. A child walks out of class because they feel trapped. That becomes insubordination. A child snaps when touched unexpectedly. That becomes aggression. A child shuts down completely. That becomes refusal. The system punishes survival responses while ignoring what created them. And once police enter the situation, everything escalates faster. Families need to understand something important here. School discipline meetings can become legal moments before parents realize it, especially manifestation determination reviews, MDR meetings. Most families have never heard the term until crisis already hits. Under federal disability law, when a student with an IEP faces serious discipline, schools are supposed to hold an MDR, manifestation determination review. The meeting asks two core questions. Was the behavior caused by or directly related to the child's disability, or was the behavior the direct result of the school failing to implement the IEP? Those questions are critical, because if the answer is yes, the school is supposed to shift back towards support and intervention instead of treating the incident as ordinary misconduct. But here is what many families experience in real life. You walk into a room where everybody already knows each other except you. Administrators, district staff, school psychologists, behavior specialists, acronyms flying across the table. The family sits there trying to decode the language while the school frames the story first. We've exhausted interventions. He made a choice, safety concern, repeated behavior. And parents often do not realize they can challenge the narrative. You can request records. You can bring an advocate. You can bring an attorney. You can ask whether accommodations were actually implemented the day the incident happened. You do not have to sign immediately. You can appeal determinations. But families are rarely prepared because nobody explained the process before the emergency. And schools know the system far better than the average parent walking into that room scared and exhausted. That imbalance matters, especially for families already blamed repeatedly for their child's behavior. Inside detention, the situation often gets worse. People assume juvenile facilities provide treatment environments. Some do provide services. Many are still fundamentally correctional environments. Rigid schedules, constant surveillance, loud units, stress, isolation from family, frequent discipline for dysregulation. Now add interrupted psychiatric medication into that environment. This is one of the least discussed realities families face. A child enters detention taking ADHD medication, antidepressants, mood stabilizers, anxiety medication. At intake, verification processes begin. Prescriptions have to be confirmed. Medical staff have procedures. Delays happen, sometimes days. Meanwhile, the child destabilizes. Attention worsens, impulsivity spikes, anxiety intensifies, emotional regulation collapses. Then the child starts getting written up inside the facility for behavior linked directly to disrupted treatment. I watched this happen repeatedly, and families often had no idea how quickly medication interruptions could spiral. A parent hands over a prescription bottle believing continuity will happen automatically. Then their child calls home days later sounding completely different. More agitated, more emotional, more hopeless. Detention can deepen instability instead of resolving it. And when youth return home, they often re-enter the exact same school systems that failed them initially. Same unsupported needs, same labels, same risk factors. That is why this pipeline keeps reproducing itself, because the underlying problems never got addressed. Now, layer race onto all of this. Black children are more likely to be viewed as older, more threatening, less innocent. That affects discipline decisions constantly. A Black boy with ADHD is often interpreted through threat perception before disability is considered. A Latino child struggling emotionally may get treated as disruptive before anyone asks whether trauma is involved. Adultification bias changes outcomes. The same emotional reaction receives different interpretations depending on who the child is. And once schools involve police, racial disparities widen even further. More referrals, more arrests, more detention. Families know this already because they have watched ordinary childhood behavior become criminalized faster in their communities. That is why this conversation cannot stay abstract. Parents need practical warning signs. If suspensions are increasing, pay attention early. If teachers keep describing symptoms as intentional disrespect, document it. If accommodations are inconsistently followed, save emails, request evaluations in writing, not phone calls, writing. Email creates records. Read the IEP line by line. Know exactly what the school agreed to provide. Ask direct questions. Was the accommodation implemented before the incident? Did staff know about the behavior plan? Was the student denied breaks or supports? If removals start piling up, understand that you may already be entering a legal process whether the school calls it that or not. Bring somebody with you to meetings, an advocate, an attorney if possible, a trusted person taking notes. Do not rely on memory alone in emotionally charged meetings. And if your child enters detention, ask immediately about medication verification timelines and mental health services. Push early, document conversations. Families deserve to know these systems before the systems move on their child, because once momentum builds, things move fast. What happened to Malik was not random. That is the point. A teacher ignored an IEP. A symptom became defiance. Discipline escalated, police entered, the system followed a familiar path, predictable, repeatable, and disproportionately aimed at Black and Latino children whose disabilities and trauma are too often interpreted as danger instead of distress. This pipeline is built through decisions. The decision to delay evaluations, the decision to ignore accommodations, the decision to underfund support staff, the decision to treat dysregulation like criminal intent. the decision to rely on police where support should exist. And if decisions built it, decisions can change it. But families cannot protect children from systems they do not fully understand yet. That is why this matters. Not because every child with ADHD ends up detained. Not because every school is the same, but because too many families only learn the rules after punishment already started. And by then, the pipeline is already moving.